Welcome to the Anxiety Management Information Session facilitated by the Employee Wellbeing Service at Cardiff and Vale University Health Board. The sources for this session today include the Centre for Clinical Interventions workbooks and the NHS Wales self-help guides. The aims for this session are: we'll look at understanding anxiety first, whilst thinking about fear, the causes and symptoms of anxiety, the cycle of anxiety and behaviours we would typically associate with it. We'll then look at improving anxiety by introducing you to some techniques such as thought challenging, worry time, progressive muscle relaxation and breathing exercises. And lastly, we'll look at signposting to resources for further support and information, such as self-help guides, mindfulness apps, and thought diaries. We'll also talk about how you can contact the Employee Wellbeing Service for further support. Normally at the end of a live session, we would have an opportunity for any questions, but as this is a recorded session, we will not have this as part of the recording. We'll look at fear and how this is linked with anxiety. So we'll be looking at this in relation to the fight or flight response. Feeling afraid or worrying is a part of being human, and the fight or flight response is an automatic physiological reaction to an event that we perceive as stressful or frightening. The perception of the threat activates the sympathetic nervous system and triggers an acute stress response that prepares the body to fight or flee. These responses are evolutionary adaptations to increase our chances of survival in threatening situations. So when do you think fear becomes anxiety? If you're watching this by yourself or watching it as a group, take a moment to pause the video and have a discussion or think about when you think fear becomes anxiety. And when you're ready, just press play to resume the video. So fear becomes anxiety when worrying is something that becomes a problem. It becomes something that's excessive, it feels uncontrollable, it's experienced as intrusive in your life, is persistent, so it's seeming to always be around, and it causes you significant distress or impairs your ability to go about your day-to-day life. How many people do you think experience significant anxiety at some point in their lives? Take a moment again to think about what sort of number you think of how many people could experience significant anxiety at some point. The answer we have here is 1 in every 20. So 1 in every 20 people will experience significant anxiety at some point in their lives. This just emphasises how common it is for people to experience anxiety, and it can happen to anybody. So you may be wondering, what causes anxiety? Well, the factors which result in an individual developing anxiety differ from person to person, though there are some major factors which may be common to people who experience it. These factors can be effectively divided into the biological and psychological causes. So biologically, there is a genetic factor that has been linked to the development of anxiety. This is based on family studies where it's been suggested that individuals may inherit a vulnerability to developing anxiety. And psychologically, a great deal depends on the person's lifestyle, life experiences, and their early learning. For example, if we were taught to fear certain situations as a child, it can become difficult to change these learned patterns of behaviour later in life, which can lead to us developing anxiety around these situations. Now we'll look at the cycle of anxiety using an image from Therapist's Aid to help show us how anxiety can develop and be maintained. At the top you've got anxiety. This is when an anxiety-producing situation leads to uncomfortable symptoms such as worry, fear, a racing heart, sweating, or a feeling of being overwhelmed. What can happen next is something called avoidance. This is when uncomfortable symptoms are controlled by avoiding the anxiety-producing situation. Some examples of avoidance include procrastinating a difficult task, skipping class or work, or using drugs or alcohol to numb feelings. Once we've used avoidance, we'll then get what's called short-term relief from anxiety. This is because avoidance can give us that immediate sense of relief, because the symptoms of anxiety lessen, but this is only temporary. Over time then, the fear that initially led to the avoidance worsens, and the brain learns that when the anxiety-producing situation is avoided, the symptoms go away. As a result, the symptoms of anxiety will be worse the next time and avoidance is more likely. So you can see how then the cycle of anxiety develops, which makes it harder for us over time to manage anxiety-evoking situations. Now we'll think about some of the common symptoms of anxiety. If you're watching this in a group or as an individual, take a moment to pause the video and think about or discuss what you think some of the common symptoms of anxiety are. When you're ready, just press play to resume the video. Some of the common symptoms of anxiety we have here include an increased heart rate, brain zaps, shaking or trembling, nausea or stomach pains, burning hot flashes in the skin, pressure in your chest or head, blurred vision, ringing in ears, or weak legs or restless legs. What other ones did you think of that aren't mentioned on this image? Before we talk about some of the ways of managing anxiety, it's important to recognise and be mindful of some of the unhelpful tools that we might use to help us manage our anxiety currently. One of these unhelpful tools, as mentioned previously, is avoidance. As we mentioned, although this avoidance instantly decreases the anxiety, over time it can make the anxiety worse and can make it harder for us to approach difficult situations. Another unhelpful tool is something called safety behaviours. This can include the security of your phone, always having an exit plan for potentially anxious situations, or making sure you have someone else with you. When you become dependent on safety behaviours, you do not learn that emotion is not dangerous, or that distressing emotions tend to come down from their peak of their own accord. This is because you try to suppress the emotion, which actually heightens the emotion, increasing the distress. So we spoke about the vicious cycle of anxiety and how this can lead to our anxiety being maintained and actually worsening over time. So one of the good ways to start to confront the anxiety is to reverse that vicious cycle. When we reverse the vicious cycle, one of the ways that we can do this is by gradually confronting feared situations. This will lead to an improved sense of confidence, which will help reduce your anxiety and allow you to go into situations. And we call this graded exposure. So you start with situations that are easier for you to handle, then you gradually work your way up to more challenging tasks when you're feeling more confident to manage. When you start to gradually expose yourself to these situations, it's important to use coping skills that can help to reduce your anxiety to a manageable level, some of which we'll talk about in a moment. Over time, this leads to a greater belief in the ability to control our own responses, so we feel better able to confront these situations without the use of avoidance or safety behaviours. One of the helpful ways you can start to challenge your anxiety is by looking at the thoughts that you might have around a difficult situation. Now, as humans, we have thousands of thoughts within a day, so it can be hard to pin down a particularly difficult thought and reflect upon it effectively. A formalized way you can do this is using something called a thought record sheet, and you'll see an example of one here on the screen. You'll see that the thought record sheet is broken down into 6 columns, and you can almost see these as steps of the exercise. Within the first column, it talks about what the situation was, and it gives you some prompting questions at the bottom to help you really think about this. So, for example, what happened? Where were you? When did it happen? Who were you with? And how did it happen? Once you've noted this down, you can start to then reflect upon how it made you feel. So what emotions did you feel at that time? And how intense were these emotions? Consider rating this on a scale of 0 to 100%. As part of reflecting upon these emotions, it's useful to also think about what you noticed in your body, such as physical sensations and reactions. And possibly think about what would others have noticed about you at this time. Did you notice that you were sweating? Did you notice that your heart was beating fast? May someone else have seen that you were sweating if you had sweat on your face? After you've thought about this, it can be useful then to think about the unhelpful thoughts and images that came up for you within this situation. Some of the prompting questions at the bottom include, what went through your mind? What did those thoughts and images mean to you? And what did they say about you or the situation? Sometimes it can be helpful to think about, well, what would be the worst thing that could happen with this situation? And what would be the worst thing about that? Lastly, it can be helpful to think about, are these thoughts based on fact or opinion? Because sometimes when we're struggling with a situation, we can get caught up in our own opinions of what's happening, and we can lose sight of the facts. Once we've been able to reflect upon the unhelpful thoughts and images, we can start to think about how we might develop a more balanced perspective, a more alternative or realistic thought. Some of the questions you can ask yourself include, well, what would someone else say about this situation? What's the bigger picture here? What might I be missing if my judgments are clouded by my opinions? Is there another way of seeing it? What advice would I give someone else in this situation? We can often be harder on ourselves than we would be to possibly a friend or a child. So think about, how might you talk to a friend if they were in this situation? What advice would you give them? And lastly then, it can be helpful to think about what you did and what you could do in the future. Reflect upon, what will the consequences of your action be? Do what works and try to act wisely with it. Thinking about what might be the helpful way to respond in this situation for you, for others, and what would be most effective. Once you've done this, re-rate your emotion again from 0 to 100% and compare it to how it was when you started this exercise. Now that you're familiar with thought record sheets, think about whether it's something you could start to implement, and think of a time that may be helpful where you could reflect using a thought record sheet. When we're challenging our thoughts, we can start to notice that there may be patterns in how we're thinking, and these are called unhelpful thinking styles. And a few examples of them are on the screen here. So you've got labeling at the top. This may be where we're assigning labels to ourselves or other people. This could be things like, I'm a loser, they're such an idiot, I'm completely useless. Other types of unhelpful thinking styles are things like that all or nothing thinking, sometimes called black and white thinking. An example of this could be, if I'm not perfect, then I've failed. Either I do it right or not at all. Another example includes jumping to conclusions. And there are two types of jumping to conclusions. There's mind reading, where we're imagining we know what others are thinking. So for example, if maybe you accidentally tripped in a public space, you might be thinking to yourself, Or that person must think I'm such an idiot. Or that person thinks I'm so stupid. When in reality, we don't know what that other person is thinking. And we'll never know what that person's thinking unless they tell us. The second type of jumping to conclusions is fortune telling, or predicting the future. We might say something like, oh, well, I'm obviously going to mess up on this. I'm going to mess it up. But in reality, we don't know what's going to happen in the future until it's happening. The final example we'll talk through is using shoulds and musts. These critical words can make us feel guilty or like we've already failed before we've even started. Oh, I should have done better. I ought to have thought that this might have happened. We can also apply this type of thinking to other people, and it can sometimes lead to frustration. Oh, well, he should have known that I was going to feel this way. He should have known that this was going to upset me. Oh, and she must have planned to upset me. Take some time to reflect upon your own unhelpful thinking styles. Maybe there's some of these that resonate with you that you can relate to. And when you're ready, continue on with the rest of the video. So now that we've spent some time thinking about how we can reverse the vicious cycle of anxiety, and we've learned about how to do this by challenging our thoughts, we'll next discuss a behavioural way of approaching challenging your anxiety. This is known as postponing your worry. And how you do this is you set aside a time, a place, and an amount of time where you'll have what's called your worry period. For example, 6 o'clock in the office for about 20 minutes. This place should be comfortable and free from distractions. And that's because when you have your worry period, this is where you're going to be thinking about your worries from the day that you'll be practicing postponing. So once you've created your worry period, as you're going about your day, if you start to have a worry pop up into your head, notice your worry and note it down on paper. And then turn your focus to the present to help let go of the worry until the worry period. Sometimes people can find it helpful to maybe say things like, I'll come back to you later, or I'll think about you during my worry period. Now, it's not just enough to say that I'll think about you later and I'll come back to you later. You actually need to do it, and you need to make that time for yourself to come back to your worries at that designated period. So at 6 o'clock, you're going to go up to the office and you're going to sit down and set a timer for 20 minutes. And that is when you're going to come back to the worries that you've noted down on paper from the day. When you are looking at those worries, ask yourself questions like, can I do anything about this today? If yes, take a small action, put a plan in place. If no, ask yourself, can I do something about this tomorrow? If yes, put it down for an action for tomorrow. If it's something that you don't have control over, or it's something that you can't do anything about, this is where we may practice trying to let go of the worry altogether and focusing on the things that we do have control over and that we can do something about. You can also ask yourself, is the worry going to matter next week, month, or year? Because this can help to put things into perspective. Have a think on how realistic it may be for you to put something like this into your life. If it is something you're interested in, think about what you might need to help you to schedule this in. What would make it a realistic goal for you? If you're watching this on your own, pause the video and have a think about this. Maybe set yourself your first worry period for the week. If you're watching this as a group, pause the video as well. Discuss this with people around you. Talk about what maybe some of the difficulties might be in this and how you could possibly overcome them. When you're ready, press play again to resume the video. On the previous slide where we spoke about postponing your worry, I mentioned about letting go of the things that we can't control. If it's hard for you to know what those things might be, it can be helpful to reflect upon this using the circle of control exercise. This is because we can't control the outside world, but we can control how we respond or react to it. So draw a big circle with a smaller circle within it, and in the big circle, put all your worries and the things that are bothering and concerning you. Then spend some time reflecting. And in the small circle, put what you actually have control and influence over in your life, such as your thoughts, your behaviors, your attitude, your body language, the choices you make. This can help to bring some perspective into the things that we maybe don't have control over, that do consume our worries, so that we can start to focus on the things we can control and let go of those that we can't. In this section now, we'll talk about how you can access some support from the Employee Wellbeing Service and where you can access further support going forward should you feel you need it to help you with managing your anxiety. The Employee Wellbeing Service is a self-referral only service, and you can access a self-referral form either via our website or by contacting us via telephone or email to self-refer. We'll then book you for a resource appointment. This is an opportunity to come and talk to a professional about any issue or situation, either home or work related, and this appointment can last for up to an hour. All of the appointments for resource that we're offering at the moment are via telephone or video using Attend Anywhere. Once you've had this resource appointment, we may discuss with you some things that could be helpful, such as resources for self-help. We might also discuss with you our workshops like these that might be useful for you to come along to. But we can also offer you counselling or guided self-help. Our counselling is for up to 6 sessions and can provide you with that space that you might need to reflect and talk through some of these difficulties. Our guided self-help is a more structured programme that also lasts for up to 6 sessions. In that time, we will support you to go through a workbook of your choosing, which may be about anxiety or low mood, for example. In your own time then, you'd complete the modules, and when you come to the sessions, we talk with you about how you've got on with it. If you need any help with any exercises you're struggling with, or if you want to talk through some feelings that maybe came up as you went through the modules. If you've had counselling with us and you feel more ready to learn some strategies to manage your difficulties, you can then step down to our guided self-help programme. And this is something that your counsellor will discuss with you at the end of your 6 sessions. As mentioned on the previous slide, we offer counselling and guided self-help for staff, which can be discussed at your resource appointment for its appropriateness for you. But we also offer things like workshops and drop-ins throughout the month. For those of you who aren't aware, we regularly run a compassion and self-care workshop, an assertiveness workshop, and a staff stress risk assessment for managers workshop. We also run workshops based on our monthly theme, so on things like mindfulness, anxiety, sleep. And we also run Q&A drop-in sessions for managers where they can find out a bit more about the service and ask any questions that they might want some answers for. We also provide training and ongoing support for staff who want to train as a wellbeing champion for their area, and we offer wellbeing support and signposting to those champions across the health board. If you feel like you might benefit from some self-help resources, we've got a range of these available. We also have newsletters and our YouTube channel, as you're here for today, where you can access the workshops that you maybe can't attend live. And we also run a monthly menopause cafe and menopause awareness session. Our menopause cafe is a space for you to come together with colleagues to explore how the menopause may be affecting you or someone you know. It's open to any staff member Regardless of their experience of the menopause, they can come along and talk in a safe space. Our menopause awareness session is a more structured workshop where we talk through some of the signs and symptoms, how you can access support at work in line with the NHS Wales menopause policy, and give some recommendations on how to manage your symptoms from reputable sources. For more information on the workshops we have on offer and to see some of the helpful resources and signposting, visit our webpage. If you feel like accessing support through employee wellbeing isn't for you, then there are some other therapy and support strategies mentioned on this slide. There is Silver Cloud, which is an online cognitive behavioural therapy that's available for NHS staff, but also for anybody with a GP in Wales. There's also Canopy, which offers a self-referral support for all healthcare and social care professionals, as well as NHS staff. And lastly, there's the Centre for Clinical Interventions, which has free self-help guides and strategies for common mental health difficulties. For further self-help and mindfulness techniques, visit the links below in the description for things on breathing exercises, progressive muscle relaxation, guided imagery, stress techniques, and self-help guides. If you have any trouble accessing any of the links in the description, drop us an email and we'll be happy to send these links over to you personally. Lastly, it's important to make you aware of helplines that are available to support you or someone else who may need a space to talk about their mental well-being. There's helplines here for Samaritans, which offer a confidential NHS staff support line alongside their regular support line. There's the Cruise Bereavement Helpline, the Community Advice and Listening Line, the Shout text service, and Mind Cymru's info line. Thank you for listening to this workshop. We hope that you found some of the information to be helpful for you or for someone else who may be struggling with their anxiety. If you need any further support from the Employee Wellbeing Service, as mentioned, please feel free to contact us and we'll be happy to send you a self-referral form to offer you some support as needed. Thank you.